my channel. Hope you're all doing good. Guys, I just wanted to talk about today's domain. This is the last domain which we will be speaking about. If you have missed the previous ones, please go back to the video section and have a look. So today we will be talking about the domain communication with colleagues. One of the easiest domain to actually score well. So communication with colleagues could be like talking to your examiner in case of structured discussions. Very rarely you could also be tested on probably like how well you are explaining to the patient about whom you are referring to and why you are referring to. But basically the major chunk of this would be when you are actually discussing with your structured discussion, with your examiner in structured discussion, and also the one in teaching task. Okay, so remember, coming to the teaching task, you need to remember teaching task is all about teaching your junior. So you would never introduce your colleague as a doctor because you are also a doctor. So you would just say, hi, I'm Sowmya, one of the ST5s, and they would be telling all the things, right? And remember, of course, about the task wise, I would be bringing up the videos, but in the teaching task, do not forget to talk about the bullying part of it. And, when you are communicating with the junior, you can use the medical jargon. And there are a couple of tips and tricks which you need to carry in teaching, which we will talk in the other video. When you come to communication with colleagues in structured discussion, how well or how safe you can do. The one thing which you guys must remember is communication with colleagues is seen how systematic you are. See, for example, when you start off again, you would say, I'm one of the exam candidates, I'm happy to start the discussion. That should be the intro which you gave. And if you don't want to tell your name, you can say, I'm one of the candidates for the exam. I have gone through the scenario and I'm happy to start the discussion. Whether it is labor ward, gynae list, whatever it is, introduce to your examiner. That's the first part. Second part, whenever you have been asked to summarize, really it is not required to tell, okay, this is the situation, this is the background, this is the assessment, this is the recommendation. Okay, so when you talk in the S-bar format, okay, we automatically know that you're talking about the S-bar thing. Okay, so rather than signposting it. Okay, and if they ask you to summarize, stick to summarizing the case rather than jumping onto the management part. Okay, and when you're being asked what additional information, you have to take the history and give a few pause. If they don't talk about examination, you can go ahead and tell the examination part. And then when they ask about the management, or if they produce any the results reports, just have a look, analyze for a few minutes and explain what the report means. For example, if the HB and MCH is low, so you need to be telling our MCV is low, you need to be telling that it's a microcytic hypochromic anemia rather than reading out the report, HB is this much, MCH, MCV, MCHC. I don't want you to read the report, okay? And if there is an image given, say that, okay, this I have confirmed the same name and this is what an ultrasound report, this is what an MRI report of this patient, which shows the diagnosis is this because of this and this. Okay, and if at all, if myostat is given also, if there is a tachycardia, if the chart shows there is a high pulse rate, low blood pressure, you are supposed to be telling, okay, this patient is collapsing because she has a tachycardia, hypotension, things like that. And when you are talking about the management, always go stepwise. If the management has, for example, fibroid uterus, there is a expected management where you don't do anything, okay? So, but you need to tell about all the sorts of management and whether it is applicable for your patient. Okay, if there is a symptomatic patient with the fibroids, you can say expected management is an option. However, it is not appropriate for her because she is symptomatic. Then in the medical management, non-hormonal, hormonal. Non-hormonal, what are the probably what are the options, what is suitable, what are the pros and cons, whether it is suitable for your patients or not. Hormonal, what is it? And then if you are going for the surgical management also, probably conservatives like myomectomy and radical like hysterectomy. Okay, so you need to tell that stepwise. Okay, and then when you come for the complications also, it's always a good idea to go immediate and later complication. Okay, and even when they ask for when you talk about the investigation, bedside investigations are the laboratory investigations, and then you go for the radiological investigation. So what I mean is, make sure that whenever you're talking, you talk it in a very systematic way, and do not jump from information to management, management to information. it's okay to get back to a couple of things. For example, you just remember that you have to give the blood transfusion, but you forgot to ask Jehovah's Witness. You can say that I would want to discuss with the patient if she's a Jehovah's Witness before I advise for the blood transfusion. Things like that you can manage. Okay. So the thing is, talk less and talk about the patient, and be slow. Keep your pace slower and give pauses. Let your examiner hear out what you're talking. Do not be like a bullet train talking very fast, which they don't understand. Give a pause and give a gap for the examiner to ask the questions. And if you have finished early, try to summarize. But if you think summarizing is going like probably it can deduct your mark, then keep quiet. Okay. And expect the examiner to have a face like mask. They don't give you any expression. Okay. So you need to be thinking that you are running in the right direction. Do not expect any encouragement from the examiner. Hope this helps, and you will all be successful if you start practicing like this in your daily practice. All the very best, and God bless, guys. May success be yours. Take care.